Marfan patients with a dilated aortic root are often treated by replacing their ascending aorta by an artificial graft. After this replacement, anticoagulation therapy is needed for the rest of the patient's life. A more recent treatment option is to reinforce the aortic root by means of a personalized support. Based on CT or MR images, a patient-specific mold of his or her aortic root is created by 3D printing. A macroporous mesh is then thermally crimped around the mold. During surgery, this mesh is taken off the mold and placed around the aortic root, preventing further dilatation. Controversy around this method exists, so we investigated how the addition of this macroporous mesh influences the motion of the aortic root. Within our center, a 44-year-old Marfan patient underwent this surgery. Preoperatively and 6 months after surgery, we took an ECG-gated CT scan of his aortic root. We can see that the vertical displacement is much more outspoken preoperatively. To further investigate the effect of the mesh around the aortic root, we determined the diameter throughout the cardiac cycle by segmenting each phase and determining the maximal diameter in that phase. The compliance of the aortic wall was calculated by dividing the change in diameter by the change in pressure. The pressure was simulated. As can be clearly seen, the compliance decreases by adding the macroporous mesh. In a subsequent step, the diastolic geometry was registered using a non-rigid registration technique onto the systolic geometry. This allows us to track the complete deformation of the aortic root. Looking at the total deformation, we already see that adding the macroporous mesh lowers the total displacement. Focusing on the axial or longitudinal displacement, we see that this is clearly decreased as well. Adding the macroporous mesh thus clearly lowers the compliance and longitudinal displacement, both important for avoiding aortic dissection. Future work will focus on repeating these measurements on more patients receiving the mesh. For more information or questions, do not hesitate to contact us.